Hi, everyone. Thank you for watching. Welcome to my Capstone website. My name is Eva Turner. I'm finishing up the SJHR program. I also hold an MS in econometrics and quantitative economics, as well as a BA in politics, philosophy, economics, and law, where I focused on behavioral economics. Professionally, I am the government relations associate at the Arizona Medical Association, where I am a lobbyist on behalf of physicians for the state of Arizona. Um, and that's kind of where my healthcare policy interest comes from. Um, so the goal of this compendium is to take that interest of healthcare policy and combine it with my interest in economics, and focus on a holistic look at health economics within human rights, focusing on sustainable policies, things that have high returns on investment, things that are human rights focused with regards to healthcare policy, but also something that could be universally applicable. But also, I was within this compendium, I'm looking specifically at the United States of America, and more specifically, I do focus on the state of Arizona because this is where I work in the health policy space. So this is my introduction page. Um, Here I have my professional headshot that I stole from my work website, with a little meet the author. So that's me. Hi. And then a little bit about myself, my own interests, which stems not only from my job, but also from me di being diagnosed with several rare chronic illnesses, starting I've had these for most of my adult life. I went from being a competitive kickboxer and a swimmer to being so sick that I couldn't move pretty rapidly, and it really kind of shined a light on the inequities that we have in the healthcare system. It's unfortunately something that people don't necessarily think about until they need to think about it. So now that it's something that has become very top of mind for me, it's something that I want to ease for everyone else so it doesn't have to be top of mind for them. I recognize that the ways that I got through my chronic illnesses came from an immense amount of privilege. And I don't think that you should need privilege to survive and have a good life. Um, the abstract of my compendium is looking at healthcare policies through a human rights lens, but also through an economics lens. So finding ways to kind of balance both. A lot of times when elected officials, at least in my experience, approach human rights centered healthcare policy, there's a lot of conversation around the initial expenditure. A lot of these policies do cost money, but especially ones that are focused on preventative care will yield high returns on investment over time. And that part of the conversation is sometimes overlooked. So I'm trying to shine a light on that, um, as well as looking at some of the socioeconomics of it. I did a little bit of SDOH work too, social determinants of health. Um, so all of the information can be found up here. We have the research overview. The research is broken into four sections, which I'll go into. And then for more, this is where my resources and references are. So moving on. Here's my research overview. It's broken into sections. So we have an introduction section, human rights as a foundation of healthcare. So basically focusing on where human rights and healthcare interplay, kind of the history of that I go into more in depth in one of my essays. Looking at health equity as a human rights imperative. So looking at it as in like poor health outcomes and the ways that they impact society as well as the person, the benefits that health equity has to society as a whole as well as the individual. I also look at the economic analysis of healthcare as a human right. In this section, I focus specifically on the Colorado Family Planning Initiative and the ROIs that generated for the state. And then this section has been very living and breathing. Right now, I'm focusing a lot on policies that exist and have been introduced. So I'll get into that a little bit more too. And then to conclude, I know that there is a huge debate around what healthcare reform looks like, but there is broad consensus that we need reform. So I'm hoping that with this compendium, I can kind of steer things in the way that I would like them to be steered, which is focusing both on a human rights aspect as well as an economic aspect. And through that economic aspect, we're going to do a lot of things such as funding more preventative care. So we're not only funding things like emergency care, which costs a ton more money. So if you go into the research page, if you just click on it, it takes you to my projects. This is human rights as a foundation of healthcare. This section just explores the intersections of human rights and healthcare, where they exist, how it came to be that way, that kind of stuff. Next, I go into the economic analysis of healthcare as a human rights. This is where I focus on the Colorado Family Planning Initiative and the ROI that it generated for the state of Colorado, as well as the impact that it had on teen birth rates and teen pregnancy rates. Um, because those pregnancies are primarily on Colorado's version of Medicare, as well as federally funded Medicare sometimes, and that those treatments also cost the state and the federal government a lot of money. So looking at the ways that all of that kind of interplayed. Then I'm looking at the current policy landscape and the future policy landscape for health economics and healthcare through a human rights lens. So this is where I talk about things like bills that were introduced in the past legislative session in Arizona, bills that are upcoming, bills that are being introduced federally and have just passed federally. And then where this interacts with like human rights, that kind of stuff. And then I have an additional policy examples section where I kind of go through some of the other policies that haven't necessarily been discussed, but do match up with this compendium. So for the purpose of time, I'm just going to go into my economic analysis of healthcare as a human right. So this part of the section or this part of the project, I am very excited about the whole thing, but this is like my baby. This is a whole, very comprehensive research paper. So this is like a formal research analysis that I've created. So I'm looking at the Colorado Family Planning Initiative. This was legislation that was introduced to allow pharmacists to prescribe birth control over the counter at no cost to the consumer. Um, the intention of this legislation was to bring contraceptive access to primarily underserved areas. If you're talking places like Colorado and Arizona do have counties that either have one OBGYN or have none, which means that you have populations of women who have to travel across the state just to get access to reproductive care. So this was something that was introduced to kind of alleviate that. As you'll see, the data that I found showed that it led to a 54% reduction in teen births and saved nearly $70 million in public assistance costs over the course of the 4 years that I studied. Um, so my different objectives were to examine the correlation between contraceptive access and reduced birth rates in teens and young adults. Also looking at the economic benefits of the public family planning services in Colorado, what that money might have been reinvested in, that kind of stuff. And I also wanted to evaluate the effectiveness of the legislation, including its broader impacts on health and economic outcomes. And then for the results, I found a really strong correlation between increased access to contraceptives and a reduction in birth rates for individuals between the ages of 10 and 24. Unfortunately, the youngest birth on record in Colorado was around 11 or 12 years old. So having access to these kind of things starting at a young age is something that was really important to the legislature there. Teen birth rates dropped about 54% following the implementation of the law. It did kind of start with a jolt. These kind of things usually take time to implement fully. So that first year or so, that it wasn't as big of a drop, but going into that second year, that third year, that fourth year that I studied, you see a really significant decrease in the teen births. But we also, for returns on investment, for every dollar spent in this program, the state saw $7.09 in public expenditures savings. So that was for every dollar invested, they saw $7.09 in savings. In other places, this was usually Medicaid, Medicare, SNAP, that kind of stuff. Um, there was also other savings in like schools and other things that kind of weren't necessarily easily correlated to, but could be pointed to as a part of this. That's money that the state of Colorado actually then went and reinvested in other parts of their state, in things like roads, education, infrastructure, those kind of really important projects. So if you go in and you click on the paper, it should take you directly to the paper so you can go through and read it all for yourself. This is a pretty long paper. It's about 15 pages. But it's a very comprehensive report that again I am just really excited to share. Um, so I go into the background, the laws. I break down all of the ways that I worked on this mathematically, including all of my graphs, charts, regressions, all those kind of stuff. It's all in here for you to see. And then if you're interested in the rest of my research, you can go to any of the rest of the topics and scroll down, scroll through, and it's all broken out the same way, except for the additional policy example section, which I'm currently building out. It's taking me a while to pull all of the pieces of legislation that I would like to include. But this is going to be kind of like it's going to have the bill number. So this one's like House Bill 2222, for example, and then I'll have the name of the bill and I'll put in a short summary of the bill, including the bill sponsor, what the bill would do. So that's all going to be in here, and I'm hoping to have it all linked directly back to the legislation so you can go back and read it in its entirety. And then moving on to the resources and references page, I also need to build this page out a little bit more. I did build it out, and then I did not like the way it looked, and I rage deleted it. Um, sorry. Uh, so this is going to be broken into two different sections. It's going to have on the top, it's going to have like a works cited page. And then it's going to have all of my works, like everything cited here that I've used. And then the next section is going to be a additional resources section. So this isn't necessarily going to be something that I like used, but it's going to be things that I think would be beneficial to for a reader who's interested in this topic to also go and read. So I have a lot of really cool books about like the history of like government and lobbying and the history of healthcare and why things turned out the way that they did. And that kind of stuff is going to go in the additional resources tab. Um, Everything can be found on here. And then at the bottom of it is my contact information. This is my work phone and my school email. And then I'm going to link my LinkedIn. I do not have a Twitter, but I'll link my LinkedIn. And for anyone who's interested in the conversation, curious about health economics and human rights, the interplays of it all, I'm really excited to keep talking about it and keep doing this research. I still have a lot more to do, but I'm really proud of how far it's come. So thank you so much, and I hope you've enjoyed my capstone.